Imagine a disease that silently enters the body, hides within the very cells that defend us, and slowly turns the immune system into a battlefield. This is AIDS-acquired immunodeficiency syndrome. It is not just a diagnosis. It is the final and most severe stage of HIV infection where the body's immune defenses collapse, leaving even a simple infection powerful enough to become deadly. AIDS occurs when HIV destroys so many CD4 T-cells that the body can no longer fight bacteria, viruses, or cancers. Without treatment, the journey from HIV to AIDS can take years, but once it occurs, the person becomes extremely vulnerable to opportunistic infections. Today, we're going to break down AIDS in a way that brings clarity, confidence, and clinical understanding for all nurses, medical students, and healthcare workers watching. When AIDS develops, symptoms are not random. They reflect the immune system's collapse. Patients may present with persistent fever because chronic infections stimulate the inflammatory response. Severe weight loss occurs as the body burns energy fighting infections and due to malabsorption from gastrointestinal involvement. Chronic diarrhea happens because pathogens like Cryptosporidium easily invade when immunity is low. Oral thrush and white patches in the mouth appear because Candida, normally harmless, grows unchecked when CD4 counts fall. A persistent cough or shortness of breath may signal pneumocystis pneumonia, which thrives in immunosuppressed environments. Skin lesions such as dark purplish patches can indicate Kaposi sarcoma, a cancer activated when immunity fails. Every symptom in AIDS is a sign of opportunistic organisms taking advantage of a defenseless host. The pathophysiology of AIDS begins the moment HIV enters the body. The virus targets CD4 T-cells by attaching to their surface receptors. Once inside, HIV uses reverse transcriptase to convert its RNA into DNA, inserting itself into the host genome like a hidden command. Over time, the virus replicates thousands of copies, destroying CD4 cells in the process. As the viral load rises, the immune system becomes exhausted and gradually weakens. When CD4 counts fall below 200 cells per millimeter cubed, the body loses the ability to mount protective responses. Opportunistic infections begin to invade, further accelerating CD4 destruction. This creates a vicious cycle. More infections, more inflammation, more immune cell death. Eventually, the immune system collapses to the point where bacteria, viruses, parasites, and even cancers take control. This clinical state is what we call AIDS. Treatment of AIDS focuses on suppressing viral replication and managing opportunistic infections. The cornerstone therapy is antiretroviral treatment, commonly known as ART. This involves a combination of drugs that block different stages of the HIV life cycle, reducing viral load and allowing CD4 counts to rise again. Patients with active opportunistic infections receive targeted therapies such as antifungals for oral thrush, antibiotics for pneumocystis, pneumonia, antivirals for cytomegalovirus, and chemotherapy for Kaposi sarcoma. Prophylactic medications are given to prevent life-threatening infections before they appear. Continuous monitoring of CD4 levels, viral load, liver function, kidney function, and drug adherence is essential. With strict treatment and follow-up, even patients with AIDS can regain immune strength and prevent further complications. Nursing care for AIDS is both clinical and compassionate. Priority begins with assessing vital signs, hydration status, respiratory function, weight changes, and signs of new infections. Nurses ensure strict adherence to antiretroviral therapy because missing doses allows the virus to rebound aggressively. Nutrition support is essential, so nurses promote high-calorie, high-protein diets to counter weight loss. Infection control is crucial. Nurses educate patients on hand hygiene, safe sex, avoiding contaminated needles, and recognizing early symptoms of opportunistic infections. Emotional and psychological support is equally important, as many patients face fear, stigma, and social isolation. Nurses coordinate multidisciplinary care, reinforce medication education, and help patients build long-term therapeutic routines that sustain their immunity and quality of life.